Hello, and thank you for joining this training. As a school nurse, you play a critical role in supporting students' health and well-being every day. One area that often goes unnoticed is bleeding disorders in young people. These conditions are underdiagnosed, especially in menstruating adolescents, which can lead to years of unnecessary complications. Your job is not to diagnose, it's to notice early signs, provide support, and help bridge students and families to medical care. Here are some of the most common signs of a possible bleeding disorder you may see in schools. Bleeding lasting more than 7 days, soaking through a pad or tampon every 1 to 2 hours or having to change protection during the night, passing clots larger than a quarter, or needing to double up on protection, frequent bleeding through, soiling clothes during periods, or even missing school due to periods, or sudden gushing or flooding bleeding that disrupts daily activities, or constant abdominal pain during periods.
Some of the common signs of iron deficiency, otherwise known as anemia, that you may see in students are fatigue, which is just feeling tired, dizziness or a sense of feeling lightheaded, feeling short of breath, pale appearance of skin, craving ice or other non-food items, or even headaches.
Another time you may see signs of potential bleeding disorders in both male and female students are during frequent nosebleeds, which could present as more than 5 nosebleeds in a year, bleeding that lasts longer than 10 minutes, nosebleeds lasting several hours, nosebleeds that need packing or medical attention, frequent smaller nosebleeds that keep coming back over weeks, vomiting blood or coffee ground material, or other signs of iron deficiency or anemia.
Some of the other signs and symptoms you could encounter are excessive bruising or bleeding with minor injuries or procedures, other bruises larger than a quarter that often appear raised from the skin with little or no injury to accompany them. Family history can also be an important indication. Family history of heavy periods, frequent nosebleeds, or diagnosed bleeding disorders. Joint symptoms such as warmth, swelling, stiffness, or tingling in a joint, and in younger children, refusal to straighten or use a limb. Every one of these signs should prompt further attention.
When you notice concerns, you can use a short screener, just 5 questions about periods, nosebleeds, bruising, bleeding with procedures, and family history.
If the student answers yes to any question, here's what to do next. First, provide support right away. Offer a period kit and a nosebleed kit. These not only help students manage symptoms, they also show that their concerns are real and valid.
Next, document what you saw and did. Write down the date, the screener result, and that a kit was given. These time points matter. They help track how quickly students move from symptom recognition to receiving the medical care they deserve.
Then, refer the student for medical follow-up. Most families will start with their primary care provider, but if the situation seems urgent or there is a strong family history, recommend referral to a hematologist or a comprehensive bleeding disorder center, also called a hemophilia treatment center, or HTC for short.
Remember, you're not replacing medical providers. You're bridging students and families to the care they need.
Sometimes you'll see urgent warning signs that need immediate attention.
One example is soaking through a pad or tampon every hour for 2 or more hours.
Dizziness, fainting, extreme fatigue, or appearing very pale, these can all point to significant anemia.
Another red flag is a nosebleed that lasts longer than 20 minutes, even with pressure.
Or bleeding that just won't stop after dental work, an injury, or another procedure.
In these situations, follow your school's emergency protocol and escalate to same-day urgent care or emergency services.
For non-urgent positives, referral within 1 to 2 weeks is appropriate.
Before wrapping up an encounter, here's a quick checklist to make sure you've covered everything.
First, make sure you've completed the screener. That's step 1 every time.
Then, confirm you provided a period kit and a nosebleed kit, sometimes even a few extras if needed.
Log the date and time while it's fresh. Those details matter later.
Reach out to a caregiver to keep them in the loop about what you noticed and provided.
And finally, document any referral you made. Even noting referred to PCP can make a big difference.
That's really all it takes to make a measurable difference for these students.
By spotting these signs early, you help students avoid years of misdiagnoses, repeated ER visits, and even long-term complications. Just as important, you give them dignity and support in the moment.
Thank you for being on the front line of early detection. Your role is essential to not only to the health of individual students, but to the larger public health goal of making bleeding disorder care more equitable and timely.